Dr. Mahesh L. Karandikar. Dr. Mahesh Karandikar, I request him to come up on stage as well. He is a neurosurgeon trained at the KEM Hospital, University of Mumbai. Earlier, he had done his post-graduation MS from the BJ Medical College, Pune. He is a life member of the Indian Epilepsy Society, Neurological Society of India, and Vice Chairman of the Nasik chapter of Multiple Sclerosis Society of India and many related organizations. He is in neurosurgical practice in Nasik since the last 24 years.
इस शैक्षणिक सत्र का विषय है योग चिकित्सा के प्रमाण। इस सत्र के अध्यक्ष हैं डॉक्टर आनंद बाल योगी भावनानी जी। हम श्री भावनानी जी का फिर से स्वागत करते हैं। वी वेलकम यू सर। इस सत्र के पहले वक्ता हैं डॉक्टर महेश एल कारंदीकर। आपके वक्तव्य का विषय है प्रमाणभूत योग का चिकित्सात्मक व्यवसाय में समाकलन, भारतीय परिप्रेक्ष्य।
Our second speaker is Dr. Akshay Anand. I request him to please come up. He is a professor, editor-in-chief of Integrative Medicine International and Annals of Neurosciences. He is also the zonal coordinator of the Niyantrit Madhumedha Bharat of the Indian Yoga Association and a senior scientist at SSIAR, Bangalore.
इस सत्र के दूसरे वक्ता हैं डॉक्टर अक्षय आनंद। आपके वक्तव्य का विषय है योग चिकित्सा पद्धति में समग्र स्वास्थ्य की आधारभूत प्रक्रिया की समझ। हम सभी वक्ताओं का हार्दिक अभिनंदन करते हैं। वी वेलकम यू ऑल। आई नाउ रिक्वेस्ट डॉक्टर गणेश राव टू फेलिसिटेट आवर चेयर एंड स्पीकर।
I request Dr. Mahesh Karandikar to give his presentation. He is a neurosurgeon, and so I would expect that we are going to go deep into the brain and the brain structures, and so looking forward to your presentation, sir. The stage is all yours. I welcome Dr. Mahesh Ji to give his presentation.
Change it. Good morning, everybody. Respected chair, respected dais, colleagues, Kaivalya Dham team, and the guests who have come with a quest for knowledge related to yoga. First of all, congratulations to Kaivalya Dham, Dr. O.P. Tiwari ji, Subodh ji, for organizing such a wonderful kind of conference. We have experienced organizing many conferences, but what touched me was the complete involvement of the juniors and the therapists and everybody getting involved in their work. Really speak about yoga here. So the whole atmosphere is full of yoga. See, I am a neurosurgeon and one of the founder members of International Coma Society. There are many advances in the management strategies of coma patients, And one of the latest development in management of coma is an operation called as dorsal column stimulation. See, there are dorsal tracts in the spinal cord, and it has been shown that stimulation of these dorsal tracts in the spinal cord by a specific implantation of specific electrodes into the spinal cord, which are connected to radio frequency transducers, which are implanted surgically into the muscles, paraspinal muscles. And then radio frequency currents stimulate these spinal tracts through these implanted electrodes. They go higher up through the brainstem, through the subthalamic nuclei, thalamus, and then thalamocortical radiations, and patients come out of coma. See, the Japanese devised this surgery, and the world was impressed. Initially, it was very hard to believe that coma means something is wrong with the brain, and how an operation on the spinal cord can be correlable to effective management of coma surgically. This particular surgery, DCS, was devised by Professor Tetsu Kano from Fujita Health University. I met him in one of the world conferences in Singapore, and I also asked him as to how could you come to the idea of starting something that the problem is coma related to brain and you stimulate the spinal cord. A long discussion with him took me to believe that probably it is the concept of our own Kundalini which ignited him to think and stimulate the dorsal column of the spinal cord and get the patients from coma come out. As all of us know, people wonder where is the connectivity, where is the connection? But we all with the Yoga Foundation know very clearly that Muladhara is connected to Swadhisthana, Swadhisthana is connected to Manipur, which is again connected to Anahat, Vishuddhi, Ajna, and Sahasradhara. So the whole link, the neurospinal axis is one, and our goal should be a unified development, unified synchrony, unified stability of the entire neurospinal axis. Once we decide this goal, then we can gradually evolve various ideas how a stable, synchronized neurospinal axis lead to health of entire body systems, and a normal physiology of entire body system forms the foundation of further progress of yoga. Now, when you talk about integration of various disciplines along with yoga for a better patient care. See, the topic I'm going to talk is integration of yoga in clinical therapeutic practice. Indian scenario. What we lack probably is present scenario is a lot of allopathic doctors practice allopathy, surgeons would restrict themselves to surgery, Ayurvedic doctors have their own domain, homeopaths have their own domain, naturopathy is another track. So why not come together? And precisely with this aim and objective, we at Maharashtra Health University in Nasik have started Interopathy section, which deals with getting everybody on one platform and develop a kind of holistic approach for developing a better patient care. Now, when we talk about integration, integration has to occur at multiple levels. It has to occur at family physicians level. It has to occur at specialty level, it has to occur at super specialty level, it has to occur at university level, and it has to occur at state level, national level, and then international level. Now, when you talk about any new treatment, there has to be evidence, isn't it? And that's precisely is the goal of evidence-based practice in yoga therapy. Because many people have questioned that I feel doing this is good. Many can question mark, where is the evidence? On what basis are you saying this? So, establishing an adequate research base should be our priority. And I was really impressed to see the work which is being done at Kaivalya Dham. What probably we need to expand is on the basis of technological development. Any research should have some objective criteria, electrophysiological studies, imaging, functional MRI, vascular studies, perfusion studies, and so on and so forth. So if a very good patient base, a good clinical research coupled with objective image as well as electrophysiological base is connected together, then we can come out with large number of research papers to this particular point. Also, it is essential that randomized control studies should be done. That X number of patients followed yoga, X number didn't, and what is the result. the result has to be statistically significant. Now, let us see one by one what all areas we can focus on. I see many students here, so let's start from the basic. See, the neuraxis consists of brain and spinal cord. The brain has various areas, See, the brain has the frontal lobe, which is the seat of intelligence, the temporal lobe, which is the seat of emotions, and the parietal lobe, which is the seat of coordinated activities. The occipital lobe deals with visual interpretation, the cerebellum deals with balance, and there has to be a synchrony between the activities of all these parts of the brain. Now, brain has two hemispheres, right and left. The right half deals with creativity, art, music, thinking, emotions, and the left deals with analytical ability, intellectual functions, language, and mathematical abilities. The synchrony between right and left is extremely essential, because if the right is not functioning in synchrony with the left, then that can form the basis of large number of neuropsychological as well as neurological disorders. It has been proven. Now, the functioning of brain is essentially in the form of electromagnetic waves. So cortical stability on the surface of the brain is extremely essential for a healthy brain and a healthy thinking. If there is something wrong with the cortical currents, then these extra abnormal unwanted electric discharges from the brain surface can come down the spinal cord through the nerves, and they activate muscles, and patients land up into epilepsy. We have done studies. I presented my work on the influence of traditional yoga and pranayama therapy in the management of patients with epilepsy way back in 2006. And we have concluded that in significant number of patients, traditional yoga and pranayama are excellent adjuncts to medical therapy in patients with epilepsy, and it significantly helps to improve the quality of their physical as well as psychological also. See, this is very, very important in many disorders like epilepsy. When a child has epilepsy, the parents are shattered, now what will happen to my child? As the child grows, even in schools, they are being looked upon as, somebody different, and that makes them land into depression and so many other problems, emotional instabilities. Their social perception, their occupational rehabilitation, and a better family life should be focused upon, and yoga has a huge role to play in all these kinds of areas. Epilepsy, as we know, essentially involves converting the currents which are not synchronous into currents which are synchronous, which makes the cortex electrostatic and stable. Now, this is very much possible to be achieved by yoga. See, the conventional therapy of epilepsy is to stabilize the cortex by using drugs. But as you use drugs, as we know, every drug has some kind of a side effect. So we are accepting the side effect because any drug is taken when the side effects are, better to accept than the disease. But with yoga, we have significant improvement in patients with epilepsy. Now, it can be documented by electrophysiology, and now we have modern tools like electrocorticography, where we have recordings directly from the surface of the brain cortex when we do operations for epilepsy. See, the usual management of epilepsy presently in conventional allopathy is initially drugs. If a patient is resistant to drug, then multiple drugs. In multiple drug resistant cases, refractory epilepsy cases, surgery for epilepsy. And here, yoga as a tool for electrostatic stability on the cortex could be a very, very important area which should be looked into. Another important thing one has to know, that organic epilepsy should be ruled out. See, these extra abnormal electric discharges can get generated from, say, head injury, brain hemorrhage, stroke, brain tumors, small granulomas like neurocysticercosis, which is very, very common in our part of the world. But if the imaging is normal and what we call as primary generalized seizures, then yoga could be a very, very important option which we must consider after the imaging. CT scan, MRI scan is all normal. Now, in yoga and epilepsy, as I said, one should not have a misconception that yoga would replace completely the medical or surgical management of epilepsy. Yoga we are talking about at the moment, evidence-based, is as an adjunct to treatment of epilepsy. We have seen that many patients who used to need multiple drug combinations have reduced the requirement to single drug. A patient who was controlled on a single drug has started needing much lesser dose, and as we know, lesser the dose, lesser are the side effects. Also, the duration of therapy of epilepsy is significantly improved in patients who are following certain protocols of yoga and pranayam, and also the chances of recurrence of epilepsy after the patient has stopped medication also has significantly improved if the patient continues to follow yoga and pranayam techniques regularly even after stopping the treatment. For getting all the patients together of epilepsy, we have formed the largest self-help group in the state of Maharashtra for patients in epilepsy, named Shwas. The essential objectives are S for social rehabilitation, then health education. See, patient compliance improves if you make them aware the essential role of yoga into this. The work guidance, many people are rejected from their workplaces, you know, that they are chucked off because they had a single seizure at workplace and then they land up into depression. So their rehabilitation and work guidance is also an important area. And I expect many more such self-help group and epilepsy registries to come out in the country. That really helps not only the basic research but also helps to spread the awareness in society about the role of yoga in various diastheses. Now, we have certain proposed projects which many other organizations also I strongly would recommend to undertake. Electrophysiological assessments needs to be highlighted in patients with epilepsy and other neurological illnesses. Neuropharmacological assessment also needs to be documented. See, many a times I have come across institutions who are doing this for epilepsy, but they don't have record of the drug level estimations. We have shown that the required drug dose which is necessary for the patient has significantly come down. I mean, if a patient was getting 1000 milligram of drug to maintain a therapeutic drug level, the same patient would need 750 milligrams or 500 milligrams of drug to maintain the drug level. And as I told you, lesser the dose, lesser are the side effects. The neuropsychological batteries have to be used for assessment of neuropsychological status of patients before they undergo yoga therapy and after they undergo yoga therapy. Psychosocial influences should be discussed upon, lifestyle management should be taught, cognition studies should be done through psychophysics. Psychophysics is an extremely rapidly growing branch now, and yoga is one area where psychophysics would surely help for research as well as for the progress of the person. A lot can be spoken on psychophysics, but let's move on to further disorders. Say, let's come to spine now. Spine, as we know, has got cervical area, dorsal area, lumbar area and the sacral area. Now, classical patients do come for slip disc. As many of us know, we have a prolapse of a disc. This pointer is somehow not working. Patient has prolapse of a disc which is compressing certain nerves. Patient has sudden acute severe low back pain with tingling, numbness, paresthesias radiating down the lower limbs. Sometimes they do have involvement of bladder as well as bowel. The conventional therapy is surgical. We take out the prolapse fragment of the disc and make the nerve root free. Earlier, there used to be a lot of damage to surrounding spinal structures. Then what happened in the developmental phases is there are concepts of spine preserving surgeries. Last year, I shared a session on spine preservation surgery in the World Spine Conference. There, the lamina, which used to be removed earlier, is now kept back again. In simpler words, we call it laminoplasty. So, lesser the harm, better it is. Now, further advancement, to prevent damage to all the surrounding neural structures, we came up with microneurosurgery. So we operate under microscope and reduce the damage to surrounding structures. What is the goal? Goal is to minimize the morbidity and paralysis through the operation. Another development is now neuroendoscopy or spinal endoscopy. Through a small minimal aperture, we reduce the exposure and remove the disc. Again, what is the goal? The muscles around should not be damaged. But the importance of muscles, which yoga understand, has not been yet adequately understood by the modern sciences. See, muscle has an immense role to play in management of spinal diastheses. In muscles, we find there are muscle spindles. Their dynamic interaction, the relationship of muscle with the tendon, with the aponeurosis, with the attachment of tendon to periosteum of the vertebrae, all this needs to be taken into consideration. And I believe that yoga would get transformation into all these things which is not addressed in conventional spine surgery. So if spine surgery goes hand in hand with yoga therapy, then the results would be phenomenal on several grounds. Number one, prevention. If the muscle strut is strengthened, then naturally the chances of disc prolapse could be low. Even patients who get surgeries done, post-operative recovery and improvement could be very good with certain protocols of yogasana. And number three, prevention of recurrence of slip disc also, yoga and asanas would have a big role to play. Now, I see many times patients who say have obesity, huge weight. I have operated upon, say, a patient weighing 118 kilo patients came for slip disc operation. Even if you do a beautiful operation, the patient is very likely to have another prolapsed disc unless the weight is reduced. The fitness of spine cannot be healthy, if the weight is 100 plus. Therefore, we have designed a holistic approach for spine care, and we have started a spine care clinic. And we formed a team. I, as a neurosurgeon, there is a dietitian who would look into the diet of the patient, which would help him reduce his weight. Then, of course, yoga therapist. We have a physiotherapist also. Now, there is a difference between yoga therapy and physiotherapy. That is a topic by itself, but that needs to be highlighted. And a proper yoga therapy can have immense role to play in management of spine with or without adjunct of physiotherapy. Endocrinologists also have an essential role because, as we know, there are disturbances in hormones in the body. Stress related disturbances can lead to obesity and so many other problems which can burden the spine, which is already osteoporotic after a certain age. Psychological counseling is extremely essential for longer follow-ups and better patient compliance, because large number of patients do not feel that they need a continued treatment to make them fit. And if you make them aware, if you use this surgical incidence as an opportunity to educate them, then that would definitely help them over a longer period of time. And this multidisciplinary approach in spine care really has given us wonderful results. Now let us come to another group. There is stroke and paralysis. Stroke, as we know, is essentially of two types. One is when a particular vessel of the brain is occluded because of atherosclerosis and intraluminal blockade, with result that a part of the brain doesn't get blood supply and gets infarcted. And another group of illness is a stroke where there is rupture of a vessel and there is a clot. So, ischemic stroke and hemorrhagic stroke. Both these involve abnormality in the blood vessels which supply blood to the brain. Now, yoga has a big role. As we know, the central circulation as well as peripheral circulation, if one can improve by yogasana and pranayam, then that can have role in stroke management at various levels. Prevention of stroke, treatment of stroke, as well as rehabilitation once the patient comes out of the incidence of the stroke. The dynamic equilibrium between the flexor group of muscles and the extensor group of muscles has been addressed to in yoga. Because as we define asana, sthira sukham asanam we say, isn't it? Whenever you have sthira sukha, stability in the asana, that is real asana. So that essentially involves at micro level, at the level of muscle spindles, the dynamic balance between the flexor and extensor group. And this is what is extremely essential in skillful movement, skill development. And one of the major limitations in stroke rehabilitation is the skillful activities are lost after stroke. And then the patient lands them into depression. A lot of people who are, say, working in skillful areas, they feel now how my life would be. I will not be able to do my skillful job. So yoga would have an excellent role to play, and significant number of patients who are doing regular yoga and pranayam can get back to their normal skillful job again. Neurobics is another huge topic, and everybody has to learn and comprehend and perceive the importance of neurobics in management of several diseases. And yoga is, lighthouse in neurobics, I would say. If one really practices yoga, then the life quality would be definitely better. Now, another group of illnesses is role of yoga in cardiovascular disease. See, blood pressure stability, cardiac rehabilitation after heart attack, after bypass surgery, prevention of several cardiac diseases and vascular diseases, atherosclerosis and so many, has been adequately published by various research papers. And this itself is a topic of not only one talk but multiple talks. Unfortunately, as far as Indian scenario is concerned, we need lots and lots and lots of objective data in this area. I was talking at length yesterday over lunch with Professor Brownstein. I don't know whether he's around or not. He was sharing his experiences with me when he worked with Professor Dean Ornish. And that objective data we also need to strengthen. We have a huge population. We need to do two things. One is to make them aware and get them know the importance of subsequent follow-ups, and strengthen our equipments and infrastructure so that we can come up with 100 times better and more papers on yoga research in cardiovascular area. Rhythm of the heart, arrhythmias, cardiac arrhythmias is a big topic. The rhythm of pumping of blood by the heart. There are n number of medicines which have been evolved and failed. But yoga and pranayam say when we do anulom vilom, what do we achieve? We achieve the balance between sympathetic system and parasympathetic system. And it has been proven beyond doubt that cardiac rhythm depends on the stable balance between sympathetic system and parasympathetic system. So if we can achieve this by tools like anulom vilom, probably we can prevent cardiac arrhythmias, and probably we can treat cardiac arrhythmias without medication simply by pranayam techniques. Syncopal attacks. Syncopal attacks is a huge spectrum. There are many illnesses which can depict as syncopal attacks. But bottom line is instability between like I showed the slide on the right side and left side of brain. This balance, if we can achieve by yoga, then probably these things can be avoided. Heart maths is a branch now. There are research on heart mathematics, how heart pumps, how is the rhythm of pumping, when it slows down, when it goes up, and things like that. And everybody has documented that if the heart mathematics shows disequilibrium, then n number of problems which result because of irregular blood circulations to various organs, not only brain, but even liver, kidney, lungs, and so many other things, lead to various diseases. So if we can balance out, or we can stabilize, or if we can improve, or if we can make our heart mathematics more physiological by yoga, then large number of diseases could be prevented. Dyslipidemias, n number of trials, good cholesterol, bad cholesterol, role of yoga, role of pranayam has been proven beyond doubts. Even peripheral vascular disorders also can be prevented, treated, and the recurrence can be avoided by various yogic techniques. Now, a glimpse on other disorders, because this is a very big topic, and because one speaker is not there, I've been given a chance to interact with you for 10 more minutes. I will just finish off this in one slide. Insomnia, anxiety, migraine, stress-related diastheses, cancer, rheumatoid spectrum, asthma, n number of medical problems can be prevented, treated, and recurrence can be prevented if we use yoga as a platform. Now, Having understood the place of yoga, we have to focus, particularly for the yoga therapist here, that the misconception of yoga in general society, that yoga is just asana and pranayam, should be removed. What we mean by yoga is essentially Ashtanga yoga. See, unless a student passes first and second standard, you can't send him to fifth and sixth standard, isn't it? The basic problem in many patients, as far as the compliance is concerned, is to follow the gradual development in yoga. Few people say that we did yoga without any result. Their concept of yoga is not clear. They feel yoga is just asana, but unless you do yama niyama, you are not qualified for asana. Unless you have a stable asana, you are not qualified for pranayama. Just imagine you're doing pranayama and your asana is not stable, you will move here and there. And what kind of pranayama would you do? And if the quality of pranayama is not good, then what would be the result of that pranayama? Having said this, unless and until you master yama niyama asana pranayam, you are not qualified to go further, which is the real yoga. Because yoga is not physical, yoga is psychological. Mind you, the definition of yoga is yoga chitta vritti nirodha, isn't it? That brings us to a fundamental question as what is chitta and how to, control all that. So the journey from pratyahar onwards, pratyahar, dharana, dhyana and samadhi is the real yoga. And all yoga therapists at least should be themselves aware of this, and it is the responsibility to make their patients as well as the society make aware of this. Again, a lot can be talked on this. Now again, practical guidelines for yoga therapy. When you talk about yoga into clinical practices, the optimum utility of yoga therapy should be highlighted. Patient selection should have a criteria. Which patients and what treatment are we giving is an extremely important decision, where you need a clinical knowledge and you must involve the treating clinician. Just imagine, say I have seen patients, say rheumatoid fasciitis arthropathy of the lumbar spine, started some aggressive yoga therapy without knowing the limitations, and patients have come with fracture and dislocation of the fascial joints, where I have needed to do surgeries, So these limitations a yoga therapist as well as the patient has to understand. Up to certain limit, people feel that yes, we have understood the limitation as far as asana is concerned. For pranayama, what is the limitation? But there is a big limitation even in pranayama. Respiratory workup is essential before you undertake pranayama. A lot can be said on this, for yoga therapist about bandha. Just imagine a patient of inflammatory bowel disease. Can you give him Udiyan bandha? A patient with cervical spondylotic radiculopathy, can he do Jalandhar bandha? If you have to get it done, then you need certain modifications, and these modifications need to be highlighted by the yoga therapist. Another important area is you should highlight that you are not doing this as a cure in certain subset of illnesses. Patients would come, say cancer patients. The role of yoga has a definite place for psychological rehabilitation and so on. But a patient, came and told me that I went to him for cure of cancer. My cancer is not cured. It is the job of yoga therapists to tell them the role of yoga therapy in a particular illness right at the first session, and you must spend some time. Integration with the treating clinician is extremely essential. So is the communication with the relatives of the patient, so that the compliance of the patient would increase. And the relatives of the patient also should be given an idea about the Ashtanga yoga and the graded approach, what yoga is, because they are under the impression that yoga is just asana, and sometimes they say that yes, he has learned asana in 10 days and now we don't need a yoga therapist. So this has to be told to them that asana is a huge thing, you can't just learn in 8 days, and asana is just a foundation for further progress in yoga. And I think making the society aware of these things is an important job of yoga therapist as well as the clinician. Now, there are a lot of mysteries, in the way the neuroaxis functions. We know that the entire body system has certain protocols and way of functioning of every organ. Because the structure of every organ in the body is same, because the structure of eye is same, everybody sees a particular picture with the same size, shape, color and everything. Because the structure of ear in every individual is same, we listen to a particular musical note, we comprehend it in the same frequency, magnitude, and we hear the same words. But the structure of human brain is same in every single individual, but we see so many varieties of personalities. Where lies the mystery? Can we find an answer to it? And probably the answer to this could be found through yoga. And the journey of yoga probably began with the idea of finding out this mystery, which we have now forgotten. We have certain studies where, the balance between various neurochemicals in the brain is disturbed. You must have heard there is noradrenaline, acetylcholine, gamma-aminobutyric acid, and so on and so forth. And the balance between these two is essential for a healthy brain, for a healthy mind, for a healthy decision making, for a healthy like and dislike. And this balance is disturbed. And this leads to several diseases. And yoga talks about this balance beautifully. Now, the electric networks in the yoga, there are many branching and sub-branching. And yoga is probably helpful in destroying the unwanted circuits in the brain and strengthening the circuits which are essential in the brain. And the role of yoga on this front can also be talked upon at length, and I think large number of projects are essential in a certain subset of neurology, like demyelinating diseases and autoimmune neuropathies and things like that. They would find probably lots of things in these areas. The future in yoga therapy should be great if we put enough efforts, and social acceptance should be given a lot of importance, and acceptance in clinical world. And if these two things join in hand, and if future of yoga therapy is based on judicial use, keeping in mind Ashtanga yoga and keeping in mind do not harm if you are not able to use concept, then probably we can look forward to a great kind of future for the yoga. Yoga was in existence since the days of Swami Ulvayananda, and before that Patanjali. Our own tradition, our own heritage, our own foundation, and we in India need to strengthen ourselves as far as objective research is concerned, so that the world would follow us. Thank you so much.
Where we dwelled into the mind of a neurosurgeon and how they look at yoga. I think it is very important, and I think one of the key words that you brought out was ahimsa is the highest dharma. Ahimso parama dharma, we say, because first thing is do no harm. And I think it is very important to understand that also we need an adequate research base of Indian data, and especially you were talking about the cardiovascular conditions. I think in neurological conditions also, and virtually every condition, we need to have our own data. It is happening, but maybe it can happen a bit faster, a bit more efficiently. And that is why this type of conference helps a lot.